Text of a press statement by my humble self, Professor NNABUE, Honourable Federal Commissioner, National Population Commission, Abuja, representing Imo State. At the World Population Day 2021 commemoration, it was actually on the 11th yesterday, but because of the Sunday, it was pushed to today. And the theme of this year's World Population Day celebration is rights and choices are the answer. Whether baby boom or bust, the solution lies in prioritizing the reproductive health and rights of all people. This is taking place at the state headquarters, National Population Commission, Owerri. Distinguished members of the management team of National Population Commission, in particular State Director and other key officers, members and guests, gentlemen of the press, ladies and gentlemen. It is with great honor and pleasure that I welcome you to the press briefing of the 2021 World Population Day celebration with the theme, Rights and Choices are the Answer. Whether baby boom or bust, the solution lies in prioritizing the reproductive health and right of all people. The theme brings to the fore the enormous challenges women and girls encountered during the peak of the COVID-19 pandemic and afterwards in relation to informed choices. Full-blown consequences of the pandemic manifested when affected countries and regions applied the lockdown measures to contain and curtail the spread. Besides economic challenges, lack of access to basic health care, especially access to sexual and reproductive health care services, including family planning, constituted a huge concern. In Nigeria, COVID-19 pandemic impacted more on women and girls during the lengthy lockdown. In addition, it has exacerbated gender inequalities and gender-based violence with an increased incidence of violence under lockdowns. Evidence shows that those with access to sexual and reproductive health services historically delay childbearing in times of fiscal uncertainty or crisis. While disruptions in the supply of contraceptives combined with lockdowns are predicted to result in a sharp rise in unplanned pregnancies for the most vulnerable. Before the inception of COVID-19 pandemic, Nigeria was faced with challenges of high maternal deaths, disturbing teenage adolescent pregnancies, and childbirth, unacceptable occurrences of child marriages, low modern contraceptive prevalence rates, high unmet need for family planning, high total fertility rates at 5.3% per woman, and rapid population growth. In the frantic effort to address matters arising from COVID-19 in Nigeria, issues of reproductive health, particularly family planning, suffered complete neglect. This reverses the gains made on population management with short and long-term implications regarding efforts to align our population growth arising from high fertility rates with economic growth to create conditions for demographic transition, harnessing the demographic dividends, achieving the sustainable development goals, as well as meeting the commitments made during the Nairobi Summit of 2019. The COVID-19 pandemic lockdown posed unabated challenges that worsened the situation of women and girls, especially those in humanitarian and fragile contexts, where health and social systems were already weak. This impact of COVID-19 on sexual and reproductive health services will likely revert Africa and indeed Nigeria back to stage 2 of the democratic transition schedule of high fertility and high mortality rates. The outcome, if unchecked, will have enormous immediate and long-term negative impact on our effort to moderate population growth, improve the standards of living and quality of life of all our citizens, even during and after the COVID-19. Nigeria is usually defined by the size of its population, but of recent, it is being described as the country of the young and women of reproductive age, as there exists embedded momentum of sustained fertility increase in the next 50 years. This year's World Population Day theme draws attention to the importance of raising awareness about the sexual and reproductive health needs and vulnerabilities of women and girls. It highlights how to safeguard rights and choices as the best solutions to shifting demographics. It ensures that sexual and reproductive health rights and bodily autonomy stay on the local agenda during the decade of actions as we march towards 2030. The theme of the 2021 World Population Day, that is to say, rights and choices are the answer, whether baby boom or bust. The solution lies in prioritizing the reproductive health and rights of all people, aims to create awareness on strategies to safeguard the reproductive health and rights of women and girls, as well as eliminate practices that undermine the equality of women and girls. The awareness focuses on ensuring sexual and reproductive rights of women and girls, as well as bodily autonomy and addressing gender-based violence. How do we proceed to ensure adequate attention to arouse consciousness and the receipt commitments to address the aftermath of COVID-19 pandemic on women and girls? How do we safeguard and provide opportunities for women and girls to have choices, make informed decisions, and exercise their rights? How do we as a nation prioritize sexual and reproductive health and rights of women and girls that is devoid of gender-based violence? And how do we explore and implement interventions within the ambit of sexual and reproductive health, including family planning, to moderate the prospects of baby boom or baby bust? It starts with addressing major data gaps that limits our current understanding of the impact of COVID-19 on fertility. Timely and accurate information about births and deaths for proper understanding of our demographic shifts are collected through a national census and effective and efficient civil registration system. This raises more urgency and imperativeness for the conduct of the next Nigerian Population and Housing Census to provide data and evidence. 1. Additionally, there is need for policymakers to work to ensure that health systems are strengthened, particularly primary health care centers at community levels, to support delivery of quality sexual and reproductive health care services during and out of crisis, including the classification of this responsibility as essential. Women must be empowered educationally, economically, socially, and politically in order to exercise unencumbered choice over their bodies and fertility. 2. Government should step forward to collaborate with the private sector and its various partners to strengthen national supply chain of contraceptive commodities and consumables. 3. We need to adopt innovative modus operandi for distribution, service delivery, for instance, consider home delivery, and many other options that will expand access and use of contraceptives. 4. We need to embrace innovative models of care, such as telehealth, as well as retain skilled staff at service posts for effective and sustained service delivery. 5. We need to establish service posts and platforms for service delivery, particularly at primary health care centers, and ensure that they are well stocked with commodities and essential supplies, as well as ensure that these service posts remain functional and accessible. 6. We need to undertake advocacy, sensitization, and awareness creation through effective channels of information to educate the populace on the importance of family planning, birth spacing, location of service points, and on the benefits of responsible reproduction and population management. And 7. Finally, we need to take extraordinary measures to work with partners and the civil society organization to address the special needs of vulnerable and marginalized population, particularly those caught in emergency conditions, conflict, and crisis situations. It is important that we take note that the importance of the World Population Day is to alert the world about the dangers of overpopulation so that nations can begin to take steps towards managing their population for the overall growth and development. It is important to note that the COVID-19 pandemic threw up issues on population. Because of the lockdown, there were increased sexual activities in families, domestic violence, increased childbirth, which caused significant increase in the population, coupled with substantial lack of contraceptives and assorted drugs. That is why the theme of this year's World Population Day is very apt and recognizes the rights and choices of couples to decide on what to do with regard to reproduction. This brings to the fore the need to make for increased access to family planning services and other steps to check and manage our population. As I conclude, I wish to state that quality, reliable, accurate, robust, comprehensive, and well disaggregated data to drive the full implementation of the just approved sustainable development is a prerequisite for the addressing of the concerns highlighted by the theme of this year's World Population Day. I thank you very much for listening. God bless you. Thank you very much.